family medicine physician, the saying is you treat from the cradle to the grave. So in one day, you could treat an infant and then also treat a 100-year-old patient with a lot of chronic conditions.
The psychiatry that you get, the orthopedics, the GYN, all this stuff that internists are shaky about, you can do it right out of the gate.
And we saw everything. We saw kids, we saw adults.
If you like the idea of being the pluripotent stem cell of medicine, just do it.
A lot of the subspecialists and specialists have become so focused in small areas that they don't realize that, hey, this guy's got an ulcer, but his wife just left him last week. Those kind of things we can deal with, I think, more efficiently than probably the gastroenterologist.
There's so much flexibility. Even within one career, you could do something for a few years and then completely revamp that and change into a different setting.
As a family doctor, by God, you can pretty much walk into any place you want to go, take a dart and throw it at a globe, and you can find a job as a family physician there, and it will probably be the most challenging and probably the most rewarding experience in your life.
What you can do in family medicine, and where you can go, and the lifestyles you can have, and the variety. You can do global health. You can work on a cruise ship taking care of patients.
Your ability to arrange your type of practice, your ability to arrange your hours.
You can basically decide how busy you want to be. I get to decide how busy I want to be or not.
When you take into account the hours worked, the locations worked, the breadth of practice, the stress involved, when you take all these into account, the actual numerical difference becomes a lot less meaningful.
I remember having this conversation with the chief resident at the time, who was his last year, or fifth year of orthopedic surgery rotation, and he was still doing like every fourth night on call and just complaining about how he never got to see his wife.
I think just the variety just makes me excited about every day. And so because of that, I'm not as worried about not making the top bucks that a neurosurgeon would make or something like that.
The amount of money that we make is always going to be plenty. We're doctors. You're going to be fine. Your kids are going to go to college. Everything is, that is not a reason to choose a profession that you may find less fulfilling. And if you really want a good, solid relationship and continuity with your patients, and you want to take care of a broad age range of patients, that family medicine really should be for you.
If you want to be a family medicine physician, you have to be inquisitive and a lifelong learner, learning about all different types of medicine, because you never know what type of patient's going to come through the door and what kind of treatment modalities that you're going to have to use to help your patients.
Really, being a family physician means that you have to know everything about the entire body. You have to understand the cardiovascular system and the pulmonary system and the nervous system in great detail in order to be able to assess and diagnose patients with any of those problems. These physicians really have to be on the top of their game in all aspects of the body.
You have to be super smart to be a family doctor and to be good at what we do and to be able to handle the breadth of problems that we handle.
Family medicine physicians have a very unique potential to see the difference they make in their community. They get to go to work every day, see the difference they make in their patients' lives, follow them along over time, and when they go home at the end of the day, they get to know that they're making a difference in that community.
It's very satisfying to be there with them and be a real part of their family.